In a broad sense, secondary data studies use data collected other than the user for different purposes, such as performance reporting and evaluation, clinical decision-making, and research. Some examples of organizations that house these administrative data include Institute of Clinical Evaluative Sciences, Canadian Institute of Health Information, Ministry of Health and Long-Term Care, and Statistics Canada. And a few examples of these administrative data sources are hospital discharge records, physician billing claims, prescription drug records, and the Canadian Community Health Surveys. Like all research methods, there are advantages and disadvantages for conducting secondary studies. The advantages are that secondary data studies provide large study sample and longer observation periods. They're relatively inexpensive and faster approach to answering time-sensitive questions. They also have the ability to link with other data sources. For example, long-term care residents' self-reported quality of life surveys can be linked to their health status assessments. In addition, secondary data studies are well suited for longitudinal analysis on subpopulations and regions. On the other hand, secondary data studies operate at a retrospective approach, and there's a lack of control of the content of the data, as well as the lack of control of the quality of the data. And the statistical usability of the data is also a concern. This is a brief overview of the checklist that I'm going to go over in this video and also in your handout. First, check if the desired data can be used for secondary analysis. Outline the research topics in question, such as the purpose and hypothesis. Describe the research design. Examine the quality of the administrative data. And last two components are the research ethics approval process, as well as the research team characteristics. For the research topic in question, a group proposal should describe the rationale for the study and provide an explicit set of questions related to the study population, interventions, comparisons, outcomes, and study design. And it should also state explicitly the hypotheses so that to avoid any unsystematic data exploration and data mining. In addition, it should discuss the significance of research to emerging healthcare policies and system priorities. For the research design, the investigator should provide a rationale for its proposed design and outline detailedly its data analysis plan. For example, identifying the administrative data sets used, defining the sample in the cohort, describing the time frame for the study, and defining any relevant variables and outcomes. For example, what are the risk factors, what are variables, what are the outcome definitions. The investigator should also outline the statistical models used and explain why they're the most appropriate for the study. And they should outline any comparison groups if necessary and how to manage outliers. Lastly, it should describe the design limitations and how to manage missing data. For secondary data studies, the quality of the data is as important as the study design. As a result, the Institute of Clinical Evaluative Sciences have developed a framework to examine the quality of administrative data. It examines based on these four simple questions. First, are the data correct? So do the data reflect the truth? Are the data complete? So this examines the completeness and the comprehensiveness and coverage of the data. So do the data include all records that are collected, and do the data cover 100% of the intended population? Thirdly, are the data reliable? So this speaks to the reliability and the validity of the data. And lastly, are the data usable? So do the data adhere to the privacy laws and practices? Can the data be linked to any other data sources to reflect the healthcare complexity? So timeliness, is there a short time lag between data collection and use? And usability, are the data organized and accessible and easily used in a format? And temporal consistency, are the data elements standardized to evaluate change over time? The last two components of the research design are the research ethics protocol, which ensures privacy, security, and confidentiality, as well as the research team characteristics, with investigators who have knowledge and experience of conducting secondary data analysis, as well as biostatisticians with a strong background in statistics, epidemiology, and health research to ensure that the statistics methods used are the most appropriate. In summary, this is the key assessment criteria. Check permission for the secondary analysis of data. Describe the purpose and hypothesis of the data and its significance to research and policy. Describe the research design. Identify the secondary data used, defining the sample, time frame, variables, and outcomes, and specify the data analysis plan. Examine the quality of the secondary data and outline the research ethics protocol as well as the research team characteristics. Thank you, and please visit www.hsprn.ca for a detailed handout on secondary data studies, as well as our library of research methods, handouts, and videos.